When I think about the College of Medicine and Rady Faculty of Health Sciences, one of the things that I reflect on is, what has been the thing that draws us together, and where are we going? What do we need to think about in the future? I reflect a lot on the past pandemic with COVID-19, watching multiple members and multiple departments come together during that time period to provide not only quintessential fundamental research and output in terms of deliverables that would help Canadians, but also with coming together and trying to form good messaging from a public health standpoint, being able to extend their hands across basically, these kind of traditional roadblocks or fences in research, and really kind of bring about a needed message for people in Winnipeg, for people in Manitoba, for people in Canada to get through the pandemic.
Our college is our pride. It is the pride of Manitoba, it's pride of all of us. This college has been here for 140 years and produced the excellent physicians, excellent researchers, excellent teachers and mentors, and excellent healthcare leaders. And not just for Manitoba, but beyond Manitoba nationally and globally. So thank you to the forefathers and mothers, I guess, who really had that vision and leaving the legacy for us. So we need to take this occasion to make our commitment that we will build this further, and also through this we need to contribute to our community here to bring the best health of the community, health of Manitoba. That is our responsibility.
We are at a time of growth, as you are now, and we were stretched to increase from 70 to 100 or 110 students over that period of time. So we would put a lot of effort into developing good processes and educational underpinning to include a new admission process, a web-based curriculum to replace the old paper handouts that were given, to improve teaching using simulation by developing a medical simulation center. Research, of course, is an important underpinning, and I remember very well two programs we started: the Center for Regenerative Medicine, and in conjunction with the Regional Health Authority, the Center for Healthcare Innovation. I could go on for a long time, but all of those are wonderful memories, and this is my chance to wish you all the best and success in your futures.
My hope for the future for the Max Rady College of Medicine is that everyone in their work and learning environment feels a sense of belonging and is able to thrive as their authentic self, that it's free of racism and oppression. I'm hoping that we'll be able to enact the Okanagan Charter for health promoting environments and fully embed the disruption of all forms of racism policy. Ultimately, I'm hoping that we'll be able to collectively co-create a future that will allow us to have better health for all peoples, communities, as well as the planet.
My time in the Max Rady College of Medicine has really shaped my career from the beginning. I began as a technician in the Department of Physiology, did that for a couple of years before being persuaded to enter graduate studies. Really enjoyed doing that, went on to get my PhD, and after a couple of years away as a postdoc, came back, have had my lab here for 20 years now. And it's really been an amazing environment in which to work and do research. You have people from all over the world with different perspectives, different approaches to science, and it's a really productive environment where you can learn to do anything, and it's been wonderful. Thank you.
I've been connected to the college in some way for the past 20 years, and what I've noticed in that time is that the incoming medical school class has grown in both size and diversity. And my hope for the college moving forward is that capacity continues to grow, and so too does the diversity of the incoming students, so that we can graduate a med school class that truly reflects the population that they will serve.
I think one of the Max Rady College of Medicine's greatest strengths is the quality of its preceptors. Throughout the first 3 years of my medical education, I've had the privilege of receiving some great teaching in both the practical and didactic settings. I really appreciate the contributions of those who have given back to this community through teaching and hope to do the same myself one day.
It was exciting times in the late 80s when all over the world people were doing molecular biology, cloning, and identifying new genes and doing a lot of transgenic mice strategies. And we didn't have any of those things here, but we developed it, and I was part of that. So I knew at that time this is what I wanted to do, and for that reason I stayed here. I figured that what they're doing in bigger institutions all over the world, we could actually do it here ourselves.
There have been so many highlights during my time at the College of Medicine here in Rady Faculty of Health Sciences. 2017 being a pretty significant one with the creation of Ongomazin, the Indigenous Institute of Health and Healing, the largest Indigenous health program of any College of Medicine throughout the country. Well done. We're happy to be a part of the college and a part of your team as we continue to support Indigenous learners, develop faculty, and provide programs and services to Indigenous communities in Manitoba and in the Kavalik region of Nunavut. Congratulations on your 140th anniversary.
About half the life of the medical school has involved me in some way or another. And of course, we've been through a lot together in that 70 years. Some of the notable things, of course, were changes in just the enterprise of medicine itself, which was for many decades essentially a private enterprise, and in the latter years has become a public enterprise. There have been tremendous changes in the scope of research as we've tried to keep abreast of all of the amazing scientific and technological developments that have made medicine so much more diverse and capable of doing more than it ever was able to do. And all of that was sort of nestled in a general thrust towards an emphasis on more inclusivity rather than exclusivity in everything that we do. A colleague of mine, a graduate of the medical school for many years, a professor in Toronto, Charles Hollenberg, used to say the medical school should have its head in the clouds but its feet in the community, and I think that has been a major feature of our medical school ever since then.